What are the possible long-term effects of COVID-19?
COVID-19, what we're seeing today is that a lot of people have been facing complications much after that they have recovered as well. And this is something that we are learning from other countries too, that patients are showing a lot more symptoms even after recovery. And this could maybe last for a few weeks in certain cases, and in certain cases it can go on for several months as well. So some of the common problems that people have been complaining about is tiredness, there is muscle weakness, some form of breathing difficulty that is continuing. It's mild, but it is still there. Maybe when they do, really mild exercises as well, they're getting tired much faster. Where in some cases we're noticing cardiac issues, skin issues, and overall there's anxiety as well, because there is somebody who has gone through a very severe condition, especially during a pandemic. There were multiple factors that could cause cause some sort of mental have an effect on mental health in some sense, I would say. And in all of these cases, again, it is important that you continue to consult with your doctor, inform them about what you're feeling and how you're feeling, and monitor yourself as well to know, to identify all of these symptoms much faster. It is not important. I wouldn't suggest that you brush off all of these symptoms. If you're noticing something, observe and communicate that with your doctor, because then they are able to take good care of you and ensure that you're improving as well. There are post-COVID clinics in hospitals that are set up. You could also visit general OPDs, general medicine OPDs as well, and consult your doctor. I would say these are all ways in which you can tackle it. It is important that, if I'm going to move on to some of the very important symptoms that, should make you rush to the hospital, because and this could happen again post-COVID. What I mentioned above was all mild symptoms, but in case there are much more severe symptoms, you will need to rush to the hospital, and that could mean that your heart is racing very fast, your heartbeat is extremely fast, you are facing extreme breathing difficulty, almost like how it was when you had COVID. There is chest pain, or like we discussed, signs of mucormycosis or black fungus. If you're noticing that, very, very important for you to rush to the hospital and not delay that. Another thing that I would really like to touch upon is mental health. Like I mentioned above as well, a lot of patients have gone through home isolation during COVID. It's probably been there for weeks. Some of them have been in the hospital without getting to meet their near and dear ones. Also, given that this is a pandemic, there was a fear for your own life, and all of these things could lead to a post-traumatic experience where they're facing depression. It could be signs like they're unable to sleep well, there is a loss of appetite, and they're very anxious. They're not able to participate at work the right way. So it's important that as friends, as families, as people who work with them, as colleagues, we understand this and we do what is good for them. But also important that if you know somebody who's facing this, help them to reach out to doctors who can help them, psychiatrists, psychologists who can help them with this. Very, very important. All of this can help everyone recover much faster and feel much better.